Hey, what's up, Joe 200? All right, summer 2024. We're back. Okay, we got back from Costa Rica last night, pretty late, close to midnight, and we're just trying to reorient ourselves. And so we're entering into the third week in your class, GERO 200. And so let's check it out. What is there to expect? Okay, we'll go a couple different ways of figuring this out. First, just go into the syllabus right here. Okay, and what's happening? And yeah, all the gobbledygook, and let's go down to the schedule and see what's going on here. There it is. Okay, so we saw modules 1, 2, 3, week 1, modules 4, 5, 6, week 2, and we're entering into week 3 here, starting tomorrow, and we have modules 7 and 8. So it went 3, 3, and 2. Okay, and so with that, that's how the due dates align. So the quizzes and the discussions for these two modules are going to be due next week. Okay, so on Monday. So that's how you dial that in. There it is. All right. So due Monday. All right. So yeah. So we're going to be flying here, guys. All right. So this is the week 2 discussions right there that we're due. Here's the week 3 discussions right here, due Monday the 10th. So you can see it goes like this. So the assignment's on, then the due dates are right here below. So week 3, June. This was all the week 2 stuff is going to do Monday, tomorrow. All right. So this is last week. We asked you to do this on Monday. All right. I sent out the video on how to do that. And you guys are doing great, doing some data mining on that. Okay. So that's the drill on that. That's the syllabus. Okay. This is, of course, reiterated. If you go into the content, you can go to the content either from the home page with the nice little really colorful widgets, or you can just go right in here. All right. And so we have blown through week 1 and week 2. All right. So we're going to get into the third week right here. Okay. So we saw that week 1, modules 1 through 3, week 2, modules 4 through 6, and then here's week 3. Okay, so when you get in here, then you'll see that when you go into each component, it'll tell you right here the due date on the quiz, and then you come down here and it tells you all about the due dates again on the discussion. Okay, you guys can work ahead all you want. It's just that we got to get this stuff rifled through according to the due date, so don't fall behind. Go ahead all you want, but just don't fall behind. All right. Cool. So this video, I love the graphics that Julia's put into this. You got to appreciate all the work that's gone into making sure that this Brightspace course is clicking. Okay, there are going to be a couple little sizing issues, a couple little problems. I can't even tell you how enormous amount of the effort has been to make Brightspace be as dialed in as we had Blackboard. And a lot of you guys are taking this class because friends have told you, hey, you got to take this class, okay? And we had it dialed in Blackboard, and we have it pretty much dialed in Brightspace. There's going to be a few hiccups, okay? This is the first time we've run 200 in Brightspace, okay? Alrighty, so this video is going to be going right in here. So let's check out the assignment, okay? And we're going to go from there. All right, so this gives you kind of the preambles why this is important. We have 2 different components here that we want you to kind of dive into and to read. We have a publication that's very short. We made a PDF file by the American Psychological Association. Sadly, this short synopsis, the URL for it, the site and their website, they got rid of, okay? But we do have the PDF file right here. And they now have it backed up with this amazing website, but it's really for practitioners. And so if this is your thing, okay, there's a lot of information. Okay, that's okay. Knowledge is power. If it's only if you want more information, going into this website is not part of what we grade from. But that being said, maybe you're going to have a friend or family member who's going through some issues, psychologically in terms of their mental health, and this is a really great starting point, okay? Alrighty, so let's just go right into here, okay? We'll check this out. I'm going to download my PDF file, okay? And there we go. All right, so this is, just a real quick overview of things you need to know in terms of the mental health issues that are specifically faced by older Americans, okay? So, you guys being trained as gerontologists right now, you're getting a true appreciation of the unique problems that people that are older encounter, okay? We're going to go over later on about the statistics of when people will say first start experiencing the biggest cause of mental health, and that'd be clinical depression. And it really kicks into gear in your age group in terms of the first age of onset, okay? But that being said, when people are older, they can often have much more severe bouts of clinical depression that can lead to much more severe consequences like severe social isolation and even suicide, all right? So why is that? Well, they experience a lot of trauma, okay? First of all, getting old sucks, I used to be a kick-ass surfer, it's really hard to wrap my head around the fact that I just can't do it that well anymore, it's just like, why? I still want to do it, is what it is. My knees hurt, things like that. So that's a blow. It's hard to get to wrap your head around. Your spouse can get sick. Your spouse can die. Now you're socially isolated. Okay. What I'm talking about right here, I've had, in my time, I had 3 knee surgeries and a total knee replacement, back surgery. I had both shoulders, had surgery upon them. This is all, in the last 10 years, I keep coming back, but it's pretty hard, and you start wrapping your head around your lack of mobility, and for me, I'm still very independent, but this decline in physical health goes hand in hand with the decline in mental health, okay? When you get to the point that you lose your independence, it's really, really hard to wrap your head around. Now, like you can see, it's 11 pages, but you see, it was just the way we made the PDF file. So it's pretty short and concise, okay? So it's really, we've told you there's a ton of older people, so it's important that if your specialty is to become a psychologist, that you need to get trained in these issues, okay, and to the mental health and behavioral problems associated with getting older, okay. You get trained in it, then you're going to be a much better therapist, and be able to treat some of these huge issues that are facing older Americans, okay. So we look at it here, that's a big percentage. 20% of people over the age of 55 suffer from some sort of mental health, okay, issue. And then if you look at the issues I talked about, of loss of independence, okay, both physical and mental health problems, mobility issues, okay, you find yourself now going into a nursing home, and you go from 20% to almost 70%. So 2/3 of people have mental health problems in nursing homes, and we keep you alive. It's just, we're sort of a compassionate society. You don't just, prune the herd. People stay alive for a long time. Okay, even though this many exhibit mental health issues, sadly, only 3% of older Americans report going out to seek help. And help is everything. Help is everything. So you guys need to be on the front end of that. Believe me, whether you're just a caregiver, we're going to talk about that. So you can direct your significant other, older friend, to the right spot to get them to start feeling better, so that they, basically, and we can be totally mercenary. If they're doing better, then it's less of a burden for you. Okay, all righty. So yeah, so there's, what do we face with? We see it all around us. I talk to you guys all the time. USC does a really crappy job. Most universities do a really crappy job in terms of mental health support. It is what it is. My son has pretty profound ADD. He's been seeing a psychiatrist since he was about 3 years of age, getting his ADD medication so he can really, really do well, etc. But that being said, psychiatrists have become disenchanted with our health insurance system. So there's very few doctors going into psychiatry, and the ones that do don't take insurance. So it's completely 100% out of pocket. So these are big issues. So coordinating all this, okay, lack of services, okay, and then on the patient side, just to, there was a book back when I was a kid, and you guys probably didn't have to read it, called Scarlet's Letter, where you're branded as being weak, okay, branded as being having a problem. So nobody wants to admit this, okay? All right, so that then um, all these problems begin to just accumulate. And so when you have lots of anxiety, okay, stress, okay, um, this causes hormones to be released into your body, okay? You know what you feel like. You guys have all been there where you're stressed out for a long period of time. You start feeling crappy, okay? And there's physiological, meaning there's hormones released in the body that cause a compromise in your immune system ability to get rid of infections, okay? But at the same, because when you get an infection, you have this spike in immune function, and then it comes right back down, okay? But you can have this chronic low-grade inflammation that can be really bad, that results in cardiovascular disease, like I said, your inability to fight off infections, on and on and on and on, okay? So, the really, really sad consequence, we see that 20% of older adults and up to 30% of nursing home patients, again, suffer from depression. And these can often lead to suicide. And the statistics are really not that great on this, okay? We see that 3/4 of older adults who commit suicide have actually seen their physician last month. So they're suffering. All right, so that's the depression side. The other part is the Alzheimer's disease size, and this goes up and up and up and up, okay? So we see that, approach 10% of people over the age of 65, over the age of 85, you're basically, the statistics keep going up and up. So now you're reaching 30 to 40% of people that are over the age of 85 have dementia. It's a huge burden, okay? So we need people that specialize in gerontology psychologists. We also need geriatric clinicians that are trained in the unique features of what's happening with older people, and geriatric psychologists. Now, when you have all these problems that I've rifled through right here, and we live in a society that has easy access to alcohol and now marijuana, there is a huge, huge issue in terms of substance abuse, especially when somebody has a loss, okay? They're feeling isolated. So you've had this spouse for your entire life, for 40 or 50 years, and now you're feeling isolated, okay? And so you start leaning on drugs of abuse, and that only creates more and more problems, okay? Again, all the chronic illnesses we talk about, even something like, I'm experiencing hearing loss from all the, times I've broken my eardrum from surfing, et cetera, that makes you socially isolated as well. So, all right, call to action for gerontologists, and that's what this is all about right here, okay, guys? That's it right there. Here's the references. Like I said, it's a pretty good summary of what's going on, okay? All righty. If you want more, you can get more, all right? And this is the website right here, again, that the APA puts together. And it has really, here's the overview right here, okay? And then you can get down here and find lots and lots of information, as needed. So I'm just kind of putting it out there, guys, and you go to it as needed, okay? Awesome, cool. All righty, now, when we look back at our class, what have we been talking about? We talked about how many people suffer vascular disease and diabetes. Okay, so this is a big deal. Diabetes is a disease of excess. Okay, where we have excessive nutrients. Okay, and then genetic vulnerability. So if you have a family history of type 2, this is the age-related. It happens later in life. Combined with really having a poor diet, exercise habits that are really poor, and then high levels of stress, social isolation, things like that, then you're at risk. We're having lots of vascular problems, heart attacks. Okay, so that's heart failure from your diabetes, kidney failure, like I told you, blindness, and then we look down here. This is just a staggering statistic. 80% of people with Alzheimer's disease are either type 2 diabetic or insulin resistant, okay? So this is how we kind of put this all together, okay? So, yeah, so it's kind of shock and awe. I'm gonna sneeze right now. Excuse me. Okay, so what we want you to do now is to we read through. I'm trying to keep myself from sneezing, and I'm not going to stop my video right now because I'm too far in. All right, and then we want you to go into this special website here now on Alzheimer's disease, and just kind of nose around and educate yourself. Okay, so we come in here. There's a couple different ways you can go in here. You can click in here and learn all about Alzheimer's disease. This is the important fact sheet right here. There's some kind of widgets over here. Okay, so just nose around and find the answers to the questions that you're looking for. Okay, alrighty, it's done in different languages that we've seen there. It goes through all the issues. Okay, all right, that's one way of doing this. Okay, the other way you can do this is we can go into this one right here. I think I just went in here, didn't I? I'm going to make sure I didn't. Yes, I did. Okay. Okay. And go backwards. Sorry. Let's go into this one right here. All right. And so that was just going one of the subtabs in the other one. All right. So what has happened here? There's videos, et cetera, and we like to keep things as current as we can. Okay, but what they've done here is they've gotten rid of these widgets, and that's okay. All right, so navigate these topics is kind of what we want you to do. All right, next thing we want to do is watch these videos. This is the kind of shock and awe of the statistics. I was looking backwards. This was 2020. Okay, the numbers are going to go up, and then this right here is the mechanism of Alzheimer's disease right here. Okay, and so in this one, they talk about the pathology, and the pathology is, why do cells die off? Why does your brain die off? Okay, and they explain all the proteins that go south in here related to inflammation. You get these things called plaques and tangles that choke off neurons. Okay, check those out. All right, here we go. This is what I was talking about. Here, you guys are at the highest risk. This is the age of first onset of major depression. You see, these people may be clinically depressed out in these age groups. It doesn't mean that they're not depressed. It's oftentimes a life battle, but this is the first onset. So you see, if you're predisposed to depression, the likelihood of having it happens, right here and at an early age. You can see that in your age group is, somewhere between 10 and 15%. Okay. Now that being said, okay, we see over here that the rate of suicide, as you can see here, goes up and up and up and up as a function of age. Okay, so we're looking at people over the age of 75. Again, this is the epidemiology, and it's looking at number of deaths that are suicide per 100,000 in the population. But it's staggering that you can go from this age group, your age group right here, it's about a fourfold increase. Okay, so this is because of the things I talked about already that eat away at your mental health, your physical inabilities, your loss of friends and spouses, inability to work anymore, so loss of income. These are all things that become staggering. All right, we see here right here when we look at suicide rates. The right side, the dark side, is male. The left side is female. We see this as a testosterone-driven thing. All right, it doesn't mean women are not going to commit suicide, but we see that men are about 3 times more likely to do so. Okay, and we can see the ethnicity, and we see that American Native, okay, and Alaskan Natives have a much higher risk. And you see each group as it falls down right here. Okay. Now we're going to switch gears really to the dementia side. Again, age is the biggest risk factor, so the likelihood of getting dementia per 100. Okay, so that's a lot. Okay, we start coming out here, and we see that over 85 years of age, like I said, you're 30 to 40% in that range right here. And we see here also what's happening is that we see this difference. Okay, and we see what happens right here is this transition. Is that when women go through menopause, then they get at higher risk, okay? So there's more female than men, and it's thought to be due to the loss of estrogen that's been allowing you to hang in there, okay? This is some shock and awe numbers you can check out. Again, this is from 2021. These are some of the facts, okay? Sadly, 1 in 3 seniors die with it, okay? More than 6 million Americans are, suffering from this, okay? And then this is the other big part of the burden. You know, the amount of unpaid unpaid care. So you're a caregiver, you're a grandma, because she's got dementia. Okay, you can't put her in to a nursing home because insurance is not going to pay for it, and it's going to cost you maybe $10,000-$15,000 a month. So nobody has that kind of money. So then you have to then split your time between your own life and caring for this person who maybe physiologically is still healthy enough to keep going, but mentally they cannot live independently anymore. All right. So we can see right here again some of the issues that cross the different ethnic backgrounds. Okay. So just everybody thinks, oh my God, I'm getting dementia. You just typical age-related changes. You're going to screw up every once in a while. You make a bad decision. You kind of forget what's going on. Okay, this is benign, meaning it's not, an aggressive disease. Okay, it's just, forgetfulness. Okay, and it comes as aging. All right, and sometimes you forget which word to use. You're grasping things. Okay, you lose things time to time. I lost my driver's license in Costa Rica. I thought I had it all figured out. I was going to go surfing. I thought I better have one form of ID, and I stuck it in my trunks with a zipper. What did I forget to do? I forgot to zip it up, and so my driver's license is somewhere out there in Playa Guiones right now in Costa Rica. It's the severity, okay, and the unrelenting nature of the cognitive problems that separate Alzheimer's disease from normal age-related change. Okay, guys? Awesome. Very cool. So that's the drill on that. So that was all the reading assignments. We'll go back over here. Okay, and obviously you could open up the quiz and be doing that at the same time. That's up to you. And then we get into the discussion section. And discussion section right here, it goes over again, the cost. Okay, and so the cost is not just the direct care. Okay, cost. So like I said, insurance is not going to pay for this. So a big part of your resources you've saved your whole life are now going to be going towards paying somebody to care for you, or to care for your parent, okay? Or if you're doing it, okay, the loss in productivity, okay, is enormous, okay? And this is, for you as a caregiver, for your company that you're working for, if you're doing stuff to help old Doc Wash out, then you're not working, so your company's going to suffer. So this is all kind of the finances, the economics of this, okay? Alrighty, so you look at those numbers. Again, this is the cost in terms of care, and it goes through again this concept of caregiving and why it is so costly. So you can kind of jump around through the numbers here. It's mostly women doing the caregiving if there are females in the family. So that's just a consistent thing. So it should not be a surprise to you. Okay, and when we look at this, people that are caregivers, 80% have emotional distress, okay? And they need resources, all right, to reboot, okay, to refuel so that they can get through their lives and help the caregiver. So these are all important things to go through. Just check these out in terms of your well-being and the kids. This is an awesome video, and it talks about the effect of having an Alzheimer's friend or family member, what it does to you and your life as a caregiver, and how we need more resources for that, okay? This right here, it shows you, this is an amazing video right here, and it shows you what a patient with dementia is like, and it shows you about one of the greatest innovations ever, and that's music therapy. So you just basically watch that and check that out, okay? Then here's your prompt, okay? Do you want to be able to care for your parent or grandparent? God forbid they're going to be cognitively impaired. Okay. Should there be some type of financial support? Should there be more policy? What can we do? Everybody's living longer, all right? So this is a runaway train. So this is just where you get in and discuss what it is that we can do that would help families. If you have an identified caregiver issue, how to get you through so that you don't lose your job, so you don't lose income, okay? If you currently are somebody that is a caregiver, there are resources. So here in LA, we have a great one. One of my oldest friends, Donna Benton, runs the Family and Caregiver Resource Center. So here it is right here coming up. I clicked on it. So do please check this out, okay? because they have case managers that are going to help navigate the system, and it's a big system to have to navigate. So do check this out if you can. All right, guys. All right. I think we can end there. All right. Peace. Okay. You guys do well this week, and I look forward to grading all of your critical thinking assignments where you compared the fertility rates, and then you also compared the age structure in terms of dependency in 3 different countries here in the world. All right. Take care.